You're retired, you're healthy, but when the unexpected happens, things can change drastically. Maybe it's a fall, maybe it's a bad diagnosis, maybe all of a sudden your spouse needs round-the-clock care. And when that happens, one of the first questions families ask me is, does Medicare cover long-term care? Here's the reality. Medicare does not cover long-term care. That means no coverage for nursing homes, memory care, or a daily caregiver who comes in to help with bathing and meals. If you're planning your retirement and assuming Medicare will cover you, I want to clear that up for you right now. This is probably one of the biggest misconceptions I see in my office, as it costs families their savings when they find out the hard way. So what are Medicare's long-term care benefits really? It's short-term skilled nursing after a qualifying hospital stay up to 100 days. And even that comes with a catch. The first 20 days, Medicare covers fully. Days 21 through 100, you're on the hook for a $217 daily copay. And on day 100 going forward, Medicare stops coverage entirely. Now, Medicare covers some home health care when it's medically necessary, but that's only for a limited time. And then it covers hospice care towards the end of life. What it does not cover is what most people end up actually needing, and that's help with daily living, like bathing, dressing, meals, supervision for memory loss, and help getting in and out of bed. That's long-term care, and financially, it's on you. In Florida, assisted living costs around $5,000 to $6,000 a month. Memory care can cost between $7,000 and $9,000 a month. And a private room in a nursing home can cost between $10,000 and $12,000 a month. The average stay in a long-term care facility is 3 years. For women, it's longer. If you take any of those Florida numbers and multiply it by 3 or 4 or 5, you're looking at a 6 or 7 figure expense that can crush an otherwise solid retirement plan. And I see that's the single biggest gap most Florida retirees have in their financial picture. What is long-term care and how do you plan for it? You've got 3 choices. Traditional long-term care insurance pays for services when you no longer can handle daily living on your own. It's gotten more expensive and harder to qualify, especially after age 65, but for the right person in good health, it still works. Premiums can also rise over time, just like your homeowners or your auto insurance, so you just need to plan for that. Second are hybrid policies. These combine life insurance with a long-term care benefit. If you need the care, the policy pays for it. If you don't, your heirs receive the death benefit. Your premiums aren't wasted either way, which is why these become very popular in recent years. Now, the third is self-funding. This works if your portfolio and your financial situation is built for it, but it does require real discipline in regards to which assets you reserve for care and a real clear understanding of how a multi-year care event could affect you and your spouse. Each choice has pros and cons, and the right answer depends on your age, your health, and what you've already built. But your options become fewer every year. If you haven't made long-term care planning part of your retirement strategy yet, now is the time. Let's discuss what fits your situation.